Thank you, Andrew. So I will do the presentation in French. Is it okay for everyone with the translation? Okay. Donc j'ai le plaisir.
I have the pleasure and the honor to present to you the professionalization and professionalizing of health logistics in Burkina Faso on behalf of Bioforce and the Health Ministry of Burkina. This presentation is based upon an article that was written by Dr. Arsène Ouedraogo and by Benoît Silve. And it is also based upon the national strategy implemented by the Ministry of Health with the support of Bioforce. Burkina is a landlocked country in the heart of West Africa, and it has a pyramidal health system with 3 levels of care. Burkina was this year ranked 181st country out of 187 in the Human Index Development. So to go quickly on figures, we have epidemic diseases, non-communicable diseases, and infectious diseases. For HIV, we have a 1.2% rate, and 42% of the consultations by patients consult for malaria. Burkina Faso has a pharmaceutical system which is organized and set up with human resources in this circuit. So pharmacists and PEP, pharmacy technicians, work on all the levels of the sanitary pyramid. But we can see that in Burkina, the performance of the logistics system has a negative impact on the health system. Supply chain is identified as a limiting factor and is the weakest link in the health system. When we talk about performance of the health system, it is also important to make a distinction, such as we said before, between the health and medical functions and non-medical functions. On non-medical functions, we mean support and logistics function. In this national strategy implemented in Burkina, we have logistics functions in 3 main areas. So, of course, health product supply chain, but also management for technical equipment and medical equipment. In this limited context for limited resources in workforce and funds, it is quite obvious that medical personnel which does not know about non-medical functions, i.e. logistics function, has to focus on what they can do. And we have to create a professional framework for logistics. In Burkina, we don't really have anything outside the vertical programs, the national programs. We don't have vocational programs for supply chain jobs. This slide looks very complicated and unintelligible. It is the system for the supply chain in Burkina Faso. I wanted to make a comparison between this drawing and this one. So this is what happens when you remove all the national and vertical programs. So it simplifies a little bit the slide, but it's still quite complicated. So this is what the situation looks like. It's quite important for me to show you because we have to be aware of what the situation is like. This is from 2010. Since then, Burkina Faso has reformed the supply chain system. in order to simplify the situation and to harmonize it. So Burkina Faso has pushed international programs and has learned to go through national programs. So this is a lot more simple now. About the strategy in Burkina Faso, the Ministry of Health is working on finding sustainable solution to health logistics and to deal with the HR challenge. And this strategy has had a favorable environment created by the Ministry and Bioforce through several programs. But I would say that everything started, especially in 2011, with the participation of the Ministry of Health in the first PTD conference, which allowed us to start the discussion and develop a national plan for logistics and health. This was also accompanied by an advocacy, an active one, with the national authorities, financial and technical partners, and international organizations. All this work allowed us to have a new program which was implemented by the Ministry of Health through the DGPML, which is a general direction for pharmacy and medicine and laboratories. This is a national champion in Burkina, and it was implemented by the Bioforce Institute. This project was supported by the 5% initiative, which is the contribution of France to the global funds. And it wants to improve health product supply management and equipment availability through the professionalization of human resources for health. This strategy, which has been implemented since 2013, started from an opportunity. The ministry used a window of opportunity, and it builds on the existing status of the public sector pharmacy technicians, the PEP, for them to move to manager jobs. So this opportunity existed, and we could fill a gap there. It is a transversal and systemic approach. We have 4 areas covered by this. First of all, training has a very important role in the program, but we also have a transversal and cross area approach, and we also have a new logistician status. So the Ministry of Health has made an advocacy in order to create and to help the job of health logisticians. It is not created yet, but the law revising the legal framework for the creation of the health logistician profession is being revised, and this job could be integrated in the legal framework. We also have 25 acting health logisticians, which will be deployed in 3 pilot regions in Burkina, and they also cover 17 districts, also at the central level. Recently, we managed to get the financial support from RHAC, Regional Health Support Coalition, and it allowed us to go further in our objectives and also to implement activities which will hopefully help us measure the impact of our actions and the building of supply chains activities and the impact of this in Burkina Faso. So the objective is also to improve the access to more reliable health data, and also so that this transfer of data could be done more easily. So these 25 acting health logisticians will have to collect health data on the district level, to transfer them to the intermediary level and then to the central level for them to be processed. So we will start on an assessment which will do state of play in all 3 pilot regions. And this will allow us on 12 to 15 months with these collected data by the health logisticians and processed by the Ministry of Health. This will allow us to compare what the situation was and what the situation will be at the end of the project. On training, the project that was implemented with the Ministry of Health created a master for health logistics. So this is a master program which will be done at the National School of Public Health. The first students started in 2013. There were 11. And these 11 students integrated the program on a competition exam in Burkina. This year we have 19 students. The Ministry of Health reserved 14 places for public health agents, and 5 private students were received in the National School of Public Health. So we have private students from Burkina Faso, Central Africa, and the Comoros. The aim of the master is also to offer pre-training and also sub-regional level training. Bioforce also helps this school for training station and training of the national school trainers, so that everybody has good health skills. And the goal is for the school to be completely autonomous. We also implemented through this program some training sessions in service, because we think it's important for them to be trained all along their professional career. Some key indicators are highlighted and will also help us to document the impact of our actions. First of all, the availability of sensitive health products. So we will have indicators for SOCA rates, time delivery, storage, etc. We will also have an indicator on proportion of functional and non-functional equipment. So this is, for example, cold chain, biomedical supplies, or vehicles fleet for a health structure. Another key indicator is the availability of normative documents, and also this goes from starting the job, getting the job integrated in the legal framework, to having maintenance plans in the structure, logistic management guides, and procedure manuals. And the last indicator has to do with strengthening the human resources and capacities, which means giving in-service trainings, initial trainings in health logistics, and also a number of trained agents would be used. As a conclusion, I would say that all this work is a result of a long process, a 7-year process, from the first assessment to implementing public health logistician in 3 regions. It took 7 years. It's a long process in order to reach our goals and to reach these results. The strategy was built on an existing structure and on an existing system, and the HR are the core of this strategy. As I said earlier, we wanted to use a transversal and systemic approach in health logistics, even though it is based on vertical approaches. So the international dynamics which has developed and which is being realized through this PTD conference will hopefully allow us to facilitate the global recognition of what health logistics is about and to expand this strategy around Burkina and of the sub-region, probably. So we can also say that this experience shows that to initiate change, you need a combination of a national champion, of a technical partner and financial partner which are committed, and it works well. Also, we still have several challenges to face in order to consolidate the bases that were set up with this strategy. I would say first that the health logisticians in Burkina is a very important one, but we also should have a network of partners in order to sustain this National School of Public Health and for the school to be completely autonomous in animating this professional master. We also need to keep on advocating. We have to document it with evidence of impact and to show that in order to improve the human resources for the supply chain has a real impact on the general public health system. Thank you.